So now I'm in a very lovely position of introducing a new panel, but what we're going to be doing now is shifting from, in a way, the vision of what is possible if IDMP is really successful to how we might be able to take it forward. How might we actually, in practice, be able to move from where we are today to going forward? And what we have in the panel now is people with building blocks or initiatives or enablers of very different kinds. Again, a very diverse panel. And I'm going to briefly ask so two people don't need to be introduced, but maybe what I'll ask is the other three. Two of you are home team UNICOM people, and you're nearly a home person because we all know you and love you. But would you mind just quickly introducing yourselves, and then we'll get on with the discussion.
Sure, thank you, Deepak. Good afternoon, everyone. I'm Nicole Veggiotti, and I'm a bioengineer. I graduated at the University of Pavia with a master thesis in innovative technologies for health. During my postgraduate studies, I focused my time in the field of artificial intelligence, mainly in knowledge modeling and in development of the clinical decision support system. Then I decided to put my academic skills into practice with the role of technical project manager at Datawizard. And here I try to improve patients' empowerment in a variety of ways, also developing the applications such as the one that we have developed in UNICOM. So thank you.
Thank you very much. And of course, Datawizard is not a stranger to GravitateHealth either. Sir.
Good afternoon to all. I am Kyriacos Hatzaras. I am a program officer for EU policies at DG Communications, Networks, Content and Technology, also known as CONNECT, at the European Commission, based in Luxembourg. I have been in this field, digital health, for time immemorial, really, since 2008, and in many of its sub-domains, including clinical trials, medical devices, etc. It's a pleasure to be here, and many thanks again for the invitation to Professor Calva.
Great, thank you very much.
Okay, hello everyone. I'm Frederic from Vidal, so in France. I'm representing, so I'm a pharmacist by training, and I'm representing an international MPD provider. And I've been in this domain for the last 15 years.
That's wonderful. Thank you very much. I'll keep the microphone because I'll bring you around this way. We've had for the whole day an exposure to the things that UNICOM has produced. What I would like to know from each of you is what is it that UNICOM has so far developed? It could be a technical thing, it could be an enabling thing, a culture change or education. I mean, it doesn't matter what you like, but pick one, maximum two things that you think either that you could use or you could really see delivering in your ecosystem around you. So what excites you about what UNICOM has done that's quite real to your universe? Of course, I don't give you any warning now, sorry. You have the microphone already.
Yeah, so thank you very much for the pressure. So, well, I would say, and this is something that I already said yesterday, what is important for me is that we can get, the data. And what we heard from, I think, everyone is that we need, what is important is to have this common sense from everyone to say, yes, we need to have those data about about medications that are done the same way all over the different countries. And obviously, for me as an MPD provider that is addressing different countries, this is, you can understand this is very useful for us to say, and this is, I must say, this is a day-to-day work for us to say, okay, we have the ability to be in this and this country, but each time we have challenges. So we already try and do something, and I already discussed this yesterday about the drug model. We already have to find a way to describe the same way in the different countries. And this is what IDMP and UNICOM will bring, this implementation of the IDMP data for us.
Thank you.
It has become very clear that the project has addressed the much needed area in terms of health information of benefit to patients, and has done this in a very clear and useful way. So what certainly would be very useful now is to have more cases of bringing these assets forward and into care, first with experimenting and generating the evidence that the assets do work, do deliver added value. We are hearing from GravitateHealth that this is one case where this is being done or planned to be done. We would like to hear of a few more.
Thank you.
I think that for me the answer is the patient-facing app. Through the application, the citizen can see how the univocal identification of medicine can benefit them. Through the application that we have developed, the citizen can benefit the IDMP standard in common situation. And I think this is an answer for the problem that Zoltan told to us today. With the application is meant to help citizens understanding how to ask or request a medicine when they are traveling, which may be different from the name they see in the prescription document. So having in mind that the citizen is the main target of pharmaceutical companies, healthcare system, and national competent authorities, we can say that if the citizen, through the use of application, truly benefit of the IDMP standard, then also healthcare providers, healthcare system, pharmaceutical companies, and national competent authorities, we tend to favor its adoption. And this is exactly what we want.
Thank you.
Yeah, as I mentioned, and I can reiterate that I think UNICOM has been a great inspiration to make progress, and as a beneficiary, and in some ways also picking up the torch from UNICOM. I think yes, patient-facing apps, yes, patients can help if we do it right, and using the IDMP suite of standards to take it. Yes, it's nice to get the right, equivalent or having more information about the getting products if you're in a different country or in a different setting. But I think it's vital that we also make sure that we make the information about these medicines accessible, understandable, and usable for the people that are given the trust to take the medicines, and making sure that we then have a language of choice is actually very low-hanging fruits, thanks to the progress that UNICOM has done on the ISO IDMP. And with GravitateHealth, we also look forward to continue the collaboration on the global scale with GIDVIG and with Uppsala Monitoring Center, and some of the work that Malin and others discussed in the panel before lunch. So I think, yeah.
Thank you. You can keep.
So from the My Hatzaras perspective, in that community we have already discussed that the new EHS regulation brings the opportunity for us to design pan-European services care pathway. So today, when healthcare is intervention-based, we are talking about cross-border document sharing. In the very near future, as we move forward and more care management and health management will be in our focus, rather pan-European care pathway will be designed and managed. And as I mentioned, we will have a new call and a new project, and we intend to assemble a system where pan-European services are available, and we can provide useful information for all the citizens, not only patients, rather citizens. And we started to talk about citizens and people, not patients, power to people, because we need to provide better health for everybody. And IDMP, and for me, this smart substitution component is the most exciting because the overall infrastructure is ready, will be ready very soon, or extended by the European Digital Identity Wallet solution. So this component will receive the a meaningful use for everyday usage. And it was mentioned that UNICOM is a game changer. With EUDI Wallet, 2 game changers meet. And we hope the interference will be positive. So they will enhance each other. So when we assemble a system, when different game changers meet and provide much better solutions, health solution for citizens, the overall service level will be enhanced. So IDMP, in this respect, is very important because it is a sound basis for pan-European services, and the smart substitution component will be an important element of the European e-health infrastructure.
Thank you, that's great. I'm going to ask one more question while you are thinking about your questions. And I want to ask kind of patient empowerment question. One of the missions of the European health data space, about which I hope we're all really excited, is to increase citizen control and citizen empowerment. And you can think of that in a few different levels. One level, which is the one people tend to jump to, is people having awareness of who else has looked at their record and being able to exercise opt-outs about what they can and can't do. But another really important empowering provision is extending the right of portability. That means allowing people to be able to download a copy of their data or to redirect it to someone else. And the redirection could be to a family member, a caregiver who's looking after. So I would imagine my mother would absolutely redirect her record to me so I could keep an eye and make sure it was well. Another option is second opinions or to do your own consultation with another clinician, etc. So there are lots of empowering things, and there's a project in which some of us are involved called xShare, which is looking at putting into place the enabling of that there would be a button that a patient can press on an app and get a refreshed view. This empowerment, though, you know, a horrible, I'm going to be mean and say horrible XML tagged nasty view of your summary coming down the wire is not going to really deliver any empowering value. And actually, when I'm thinking about all of your contributions, all of you hold a piece of unlocking that horrible download into something pleasant and usable. And I wonder if you would be willing to volunteer what you see as, you know, how your topic contributes to empowerment. Would that be okay? And in your topic, it's a big one. Kyriacos is the whole the whole EHDS, so you might wish to, or the exchange format at least, you might wish to go first.
Well, absolutely. For anyone who has been watching the plenary, when the vote took place this week, it was very reassuring to see that the votes in favor were spread across the current political spectrum of the European Parliament. So this has been a key moment for us in Europe, who are now ready, steady, and can go where we have never been before. And anyone who has seen the text of the approved regulation will very well remember debates at a national level. For example, Deepak, in the UK, 10 years ago, when we were looking to develop the data protection toolkit for access of data within the NHS for research purposes, salient features and points of that time are now put in the regulation. So this is a moment that we can be very proud of, collectively, as well as individually, and it is a moment of impetus going forward. Lest we forget, a few years ago we had another challenge in terms of the pandemic, this is now an opportunity to move forward. And of course, a core part of the regulation is the European Electronic Health Record Exchange format. As we move forward as a collective in developing the format for cross-border use and also within the electronic health record systems, this is now the opportunity for contributions such as this one to feature in the experimentation, in the evidence generation, and the confirmation of those assets that can be, as per the image we projected last December, we need the European Electronic Health Record Exchange format to be not just approved as fit for purpose, but endorsed as fit for practice. Thank you.
So a very important question, but well, first I would like to say that I'm quite surprised by this question because my experience, at least in France, is that we have, well, I would not say about electronic health record, but the patient summary that we have in France is very text-based, only text-based. So very, I would say, I don't know if it's easy to read, but it's only text-based. And what we want is that it's more structured so that we can use this information. And so our challenge is then back to get this structured data that becomes more readable, human readable, and I think this is what you mean by this horrible format. So this is one of our challenges to get structured data, to supply this to our partners, which are CPOE vendors and electronic health record partners, vendors. And so we, in fact, what we do is having structured data and having also text-based data. So
yeah,
so that we can.
When I meant making it more usable and friendly, I didn't necessarily mean narrative. I mean, you can have trends, you can have charts, you can have all sorts of nice things, but only if you can compute on the data.
Yeah.
If you've got a horrible narrative only, it's really hard to make.
Yeah, for sure. And so this is really a challenge that we have every day to say how can we balance the computer readable data with the human readable data, and how can we do both? So
great.
Day-to-day work.
Thank you. That's great. Who else has a contribution to impact? Nicole is ready to roll with her.
I think that if we are able to introduce in the application developed for UNICOM the famous yellow button that we want to develop in the xShare project, this will be a great goal, because like that, the citizen is able to transmit the health data stored in the application into the electronic health record. So at this point, the benefit of using this application will be manifold. So not only providing support to patients to understand when they are traveling how to ask and accept a medicine which may be different from the prescription document, but also use data stored in the application to populate the electronic health record. And at this point, the electronic health record will have a more complete overview of the patient situation. And thus, I think many more citizens will be encouraged to contribute to the adoption of the IDMP standard using the applications.
Thank you. And I feel a bit guilty for the last two of you because your presentations were filled with empowerment messages. But I'm still asking you a chance if you want to add anything further.
I would like to add something, if I may.
Yeah.
Because this is something that I've been thinking about for a few years, actually, not just with GravitateHealth, but of course that GravitateHealth project and that we won that project gave us a great momentum. To me, there is a big paradox, and it's not getting better or getting smaller. The entity, if I may, the citizen, and I fully agree we should use that, that's present in all consultations and where health really matters, they are very ill-equipped. They are, to a large extent, today have to rely on family members, significant others, and everyone's memory, because so much of this information is transmitted or shared orally. And just think about it being a patient with a serious condition. What's your attention span? So for me, adding to what I've said already, making sure that we have available resources that's under citizen control, that it has a combination of your personal health data, allowing to curate the data as well, and combining it with information from trusted sources and health knowledge would, to me, be a tremendous resource in terms of empowering patients. That entails making sure that we have good services. European Health Data Space comes with a lot of promise, that we have ways and methodologies and experiences to combine personal health data and relevant health knowledge, health information, and testing it with patients and their significant others. And just to let you know, this is a teaser for the next 2 years. That's what we're also trying to do with GravitateHealth.
As we meet patients, as Clara mentioned this morning, so many of us meet patients in everyday practice. We started to work on different solutions which brings value based on data closer to citizens, and in a month we will publish health data value demonstrator application, where we will provide 50 different avatars as patients and visitors, users can select one of the avatars and experience how different data sets can provide value for them in personalized recommendations. So the clinical data sets, genomic data sets, behavioral data sets. And so this will be an experiment to measure the perceived value of the different data sets, because we learned that in the European health data space, consent, as you mentioned, consent and as individual is becoming the data center. In this respect, we need to demonstrate the value of data for citizens, and this will be one of the first experimentation when we will be collecting information on perceived value of data sets.
Thank you, that's fantastic. And I think you must make sure we all get the link when they go live. That's how I'd love to have fun with your avatars. Audience, who has a question they would like to ask the panel? Oh, Luke is there with the mic. Thank you.
I have a question to all of you. 15 years ago, rare disease patient group had 3 major problems. 1, finding the right diagnosis, sometimes years and years. Following medical guidelines between many different specialists in different institutions. And thirdly, participation in the society. Now, 50 years later, I do not see any improvement, personally. I see many movements. I see millions of money, EU money, into projects which are, I don't know if they're ever implemented. I don't see the implementation. So now we have digital health, okay. But still, people do not exactly know what is digital health going to help. Well, us doctors, primary care doctors, and the rare disease patients, especially these children and their families. Now the question of me is to you, what are you contribute to these 3 major problems of children who will grow up and want to live completely as everyone else in society, in small villages in Hungary, or small villages in the Netherlands, or big cities like Paris and Brussels? What are you going to contribute and change this?
So that's a tough question. I think that the diagnostic part is quite challenging given the nature of our flavor here on medication and treatment, which normally is post-diagnosis. But there are still other issues Lisbeth has raised.
Absolutely, and it is a fair question. We do have the opportunity now with the new governance model that the new regulation brings to strengthen the collaboration and interactions between the member states who have the primary word in this area of policy and the Commission in its coordinating role. It is very true that the needs are there. The debate has always been about unmet medical need and what the policy and other interventions can do to address some of those needs. But it is also in fora such as this one that we can get to hear about needs we may not have heard of or about so far. So keeping the channels of communication open is absolutely key. And the view will now be that with the enhanced collaboration and governance instilled by the regulation and shortly to be introduced, we can do more.
Not an obligation, so not everybody has to.
So just a word, just a quick word. As well, we are an MPD provider. We are also a CDS provider, and we also for France, yes, for France only, have a synthesis of guidelines regarding treatments, regarding pathologies, and so on. We are making a synthesis of different official guidelines in France and internationally, but only for the purpose of France as instance. And obviously we have linked this to the treatment, the French medications. And because we have this, this is our present, but this is the future with IDMP and the fact that drugs in the different countries are described, I would say hopefully the same way and maybe linked together in a way to say this drug in France is represented by this one or is more or less equivalent to this one and so on. This is what is facilitated by IDMP, by UNICOM, and this is something, not the only thing, but something that is. So this means that what we do for France can be extended. And this is maybe a question that you raised at the precedent panel, at the previous panel, regarding those guidelines. So for the moment, what we do here, I just talk for Vidal in France, this way of synthesizes recommendations in terms of treatment for pathology, first line, second line treatments, and so on. We can extend this. We should extend this also based on, I don't know if there are more local recommendations. We have local recommendations in France. I suspect there are some local recommendations, in, Germany, Belgium, and so on. We could extend this, but this is something that already exists, and I would say just a little bit provocative. Nothing has changed since 15 years because Vidal already did that 15 years ago. so just to be a little bit provocative on this part.
Okay, thank you. Anybody else want to come in?
Yeah, I'm taking a stab on this as well. I think in terms of the three problem areas that you mentioned, with the outputs of GravitateHealth, we've been very careful on positioning our work post-prescription and post-diagnosis. But I think a contribution on the participation side and looking at how we can contribute to navigate the information masses and point to more relevant information as we gain more experience is a contribution that we could make and alleviate the information burden and information seeking activities that I'm sure and I know that people suspicious of a rare condition or with a rare condition or caring for a person with a rare condition is desperately or is needing because it is quite complex and cumbersome. So more relevant information.
I agree that the guidelines need to be transformed into knowledge graphs. Last year at Citra, there is a metadata subgroup, and we published a health data value chain white paper in which we described how data can be transformed into value to patients. And first level is the data definition, the next is interoperability. We are at UNICOM at that level. And the next level is related to knowledge. So guidelines need to be transformed in knowledge graphs. And in the coming proposal, which I referred to several times, we will describe that core European service should be to provide knowledge graphs for the key diseases or the agreed diseases. So I agree, to provide value throughout Europe, we need to start describing knowledge graphs, which are the digital footprint of guidelines. So this is, without this agreed care pathway, digital footprints, we won't be able to provide uniform services to citizens.
Okay, so not a 100% answer, but I hope some rays of hope. We need anybody with a rare disease to be able to travel anywhere in the world and to be confronting a clinician they need to see urgently who is totally unfamiliar with their disease, totally unfamiliar with their treatment. They need to be able to go into a pharmacy and purchase an over-the-counter medicine where the pharmacist doesn't really know how to advise them well. And that's going to require nearly everything our panelists have talked about to come together. And I think there are a couple of other learning points from your remark which are not directly related to rare diseases. 15 years ago, European Commission projects had as their goal, the absolute goal, was to produce PDF documents on time that passed a review. That was it. Nowadays, that is not the feeling I get from our colleagues in the Commission. They want sustainability. They want things to last. And the energy of this panel and the previous panel and many of the parts of this room has been joining the dots. Each of the projects has a piece of the solution. None of them has it all. And you've heard from our panel members on this subject how they are looking to merge things. Sometimes the only way is to be in multiple projects, but we do that rather well. And therefore, what we are having to do is to glue together to make realistic and usable solutions. And I think these have to be the mantras for European projects going forward, not the PDF documents, but the real sustainable and usable results, and also working together. And an example is the workshop that we organized with you in December on the intro, but there have been others. And the presentations we've heard today have been about gluing together the project endeavors, and I think that's really important. I was going to think we should carry on because we started late, but I suspect people will also fatigue and say, no, Deepak, please finish on time, we're tired. So I think that is a nice way to close, and to say that I think from my point of view, as a selfish observer, UNICOM has achieved pretty fantastic results, which are entirely unusable without working with others. And that's what we have to make sure we do. So thank you very much to my panel. Please, round of applause to them.